my name is Jonathan Wilspn. I'm one of the consultant general and colorectal surgeons with an interest in laparoscopic or keyhole surgery at OneWelbeck. I perform, amongst the various techniques that we do here, keyhole and traditional open surgery for both abdominal wall and groin hernias. As we get older, one of the reasons why we go on to develop hernias is because we become less active, the muscles become thinner, that protective layer on the outside becomes thinner, and we are more prone to hernias. So trying to keep the core muscles in the abdomen and the groin engaged through a healthier lifestyle will minimize or at least reduce your chance of developing hernias as we get into our 40s, 50s and beyond. If we look at the categories of patients that are likely to get hernias or more commonly develop hernias, patients with chronic coughs, prostate enlargement, therefore straining when they're passing urine, or chronic constipation, or lower gastrointestinal disorders that has the patient going to the toilet a lot. If we can address all of these conditions and see a respiratory physician, see the urologist about the prostate, see the gastroenterologist to manage the bowel functional problems and address those actual causative factors, then certainly their chances of developing a hernia are reduced. And if they're already undergoing a surgical procedure, the chances of developing a recurrent hernia would be reduced. Recreational factors that can lead to hernias, such as heavy weight lifting, obviously taking the necessary precautions with the weightlifting belts and due diligence to make sure that you're not using the wrong body postures when you're doing those exercises. If you are experiencing musculoskeletal aches and pains, do either see professional physiotherapists or personal trainers to make sure that you're doing your sport and your hobby with the correct ergonomic methods, so that you're not over a number of months or years putting yourself at risk of developing a hernia. And also, if you have the beginnings of muscular strain or repetitive stress injury, seeing those professionals to make the change to stop you getting the hernia in the first place is always better than fixing the hernia, so prevention being better than cure. Once you've had your hernia repair, we will often recommend having at least one session with one of our allied professional physiotherapists or musculoskeletal physicians, just to give patients a bespoke way of retraining, re-engaging core muscles of the abdomen and the groin, reconditioning the tendons that can become disused if patients are not leading healthy, active lifestyles. So that prehabilitation before surgery and rehabilitation after surgery to strengthen what you've got and reduce the chances of recurrent hernia. Just one more thing to add would be, if you have had one side fixed, you are at a statistically higher chance of developing a hernia on the other side. So if you are out of shape, out of condition, it is a good wake-up call to say that the muscles and the ligaments are starting to show some weakness, and a targeted program with physios or personal trainers to address the other side and strengthen the other side to prevent new hernias on the virgin side, as well as reducing the chance of recurrence on the side that has just been operated upon.